Well, as you heard, there's going to be an actual real rock star in the house later, but I want to introduce to you now the true rock star of health data. Todd Park was recently appointed U.S. Chief Technology Officer after serving as the CTO at the U.S. Department of Health and Human Services for nearly 3 years. Since August 2009, Todd has sought to revolutionize the department's release and use of health data. Before coming to HHS, Todd co-founded Athena Health in 1997, and he's been part of a number of efforts to integrate health, technology, and innovation in a socially conscious manner. As many of you know, he's been a major catalyst of the Health Data Initiative. Please welcome Todd Parks.
Hello! It is absolutely fantastic to see all of you here. They tell me actually that many more folks want to attend, but we literally ran into fire marshal issues for which we're very apologetic, but many more folks are actually watching online. And we're all in for an incredibly action-packed couple of days. We're just thrilled to get things kicked off with all of you. This morning, it's my great honor to be your tour guide for the Palooza for the next couple of days. So first of all, to give you just a very brief history of how the Palooza came to be. To give you general updates at a high level about the Health Data Initiative, and you'll be able to learn a lot more about these updates over the course of the next couple of days. And then finally, to give you some advice as a fellow fanboy of health data about how to get the most out of your experience over the next 48 hours. So to get started, so I think as probably a lot of you know, the inspiration for the Health Data Initiative was actually the weather and GPS. So decades ago, the government made a very wise decision, which was to start opening up weather data for free electronic download by anybody, which then actually led to an explosion of private sector entrepreneurship and innovation that created things like the Weather Channel, weather.com, iPhone weather apps, even weather insurance, that added immeasurably to the quality of life of Americans and created jobs at the same time. Similarly, in the 80s, President Reagan began to liberate access to the global positioning system, which of course has spun everything from Foursquare on your iPhone to supertanker navigation systems, precision crop farming, and lots of other improvements in American life. In fact, actually, GPS alone is estimated last year to have added about $90 billion in value to the American economy, a product of open government data that actually was used as fuel by private sector entrepreneurs and innovators to turn it into massive awesomeness that helps Americans and create jobs. And so we actually thought, a team of us at the Institute of Medicine, HHS, in the White House, about 2.5 years ago, well, that's an awesome play. Let's run that play again, and let's do it this time with the vast reservoirs of health-related knowledge and information sitting in the vaults of HHS and other agencies. And we started, actually, with, a gathering in March 2010, convened by the Institute of Medicine, about 45 people that we persuaded to sit in a room for 8 hours and talk about the possibilities of liberating health data and turning it through entrepreneurship into products and services to help the American people. We actually, at the time, said, yeah, we think there's something, to this. Maybe we can get, 8 or 9 other people interested, perhaps. And you all are living proof that, yes, in fact, other people are interested in this idea. There are 1,600 plus people. Sorry, this is actually auto-advancing. Can we stop the auto-advancing? Or go back, even better. So 1,600 plus people who are gathered physically here today to take things to the next level. And the gathering sponsored by over 25 organizations led by the Institute of Medicine, Robert Wood Johnson Foundation, California Healthcare Foundation, and many others, showcasing the work of 100 amazing companies and nonprofits that were selected by independent panels of patients, doctors, nurses, community leaders via an American Idol-style competition in which over 240 companies and nonprofits competed. Amazing, amazing stuff. And so in terms of what's new and things to look for at the Datapalooza, happenings in the Health Data Initiative that have happened over the last year in particular. First of all, more data. More data is being made available in machine-readable electronic form, usable by developers and entrepreneurs, more easily accessible. In fact, today we're announcing the launch of the new healthdata.gov. It was built by an intrepid team in a very, very short sprint over the first half of this year. Go check it out. It's got massively improved search capabilities and other important features. Actually, one back, please, if you wouldn't mind. It, on top of that, actually has 400 data resources you can access for free and turn into products and services and awesomeness in general. In terms of more data, more easily accessible, there's also been great progress on Blue Button. I think probably most folks in the audience know about Blue Button. It's an initiative that was launched by the VA in partnership with Medicare and the Department of Defense that enabled about a year and a half ago any veteran, member of the military, or their family, and any Medicare senior to go to a secure website, hit a blue button, and download a copy of their own data. Peter Levin tells the story of how when he was first asked by Secretary Shinseki, how many people will actually be interested in getting their own data, Peter said, well, I think, ultimately if we blow the doors off, maybe 25,000 veterans will ultimately want a copy of their own data. Well, actually, to date, over 900,000 veterans, members of the military, and seniors have actually downloaded a copy of their own data via Blue Button. It's actually now being cloned across the private sector. Aetna's deployed Blue Button, United's deploying Blue Button, Walgreens is deploying Blue Button, McKesson for its Relay Health patient portal is deploying Blue Button, states like Louisiana want to deploy Blue Button. It's spreading across the country. You should absolutely stay tuned for Bill Core, Deputy Secretary Bill Core of HHS, his speech around about noon, because he'll be making a couple of major announcements relating to the Center for Medicare and Medicaid Services, new organizational commitment to data liberación, incredibly exciting. He'll also be making a major announcement about a new, very exciting resource for developers using an uber awesome data set that's going to be made available through healthcare.gov. So stay tuned for Deputy Secretary Core's remarks. And we're not the only people liberating data. As I mentioned with Blue Button, there are a host of private sector organizations and states that are actually beginning to liberate data. And folks like New York State, led by their visionary commissioner, Nirav Shah, have begun to deploy health data liberation portals of their own, like the Metrics data portal that New York deployed a little while ago that's making incredible data sets from New York State available. And Louisiana is actually hot in their heels, and other folks as well. So there's more data being made more easily accessible. And there is more and more innovation happening with this more and more data that's being made available. There are at this point, just a smorgasbord of challenge competitions that have been issued through organizations like Health 2.0, working with many partners, led by visionary folks like Paul Tang at the Palo Alto Medical Foundation, who actually, I think, did the first ever Ideathon, Hackathon, developer challenge launched by a major medical group, focused on successful aging, folks like Sanofi Aventis, which launched the incredibly successful Data Design Diabetes Challenge that actually is now being spawned a sequel, a second round of this challenge. And actually, one really interesting note to us is that the vast majority of challenge competitions launched to build amazing stuff with health data, the vast majority have been launched by companies and foundations outside the government. The government's actually not sponsoring most of these challenges. It's actually other folks who think of this open government and open health data as fuel to help advance the ball on causes and missions that they care about. There have been more and more hackathons, codeathons. One really notable one recently was Cajun Code Fest. Have you heard about the Cajun Code Fest? Yeah. Woohoo! All right. Right, so I always remember this. I was actually giving a talk in Louisiana about health data liberation, and I wasn't sure if it was taking or not, but in the middle of it, a guy named Ramesh Kohler who stood up and said, I am really excited about health data liberation. I want to do a health data codeathon in Lafayette, Louisiana, as soon as humanly possible. I remember saying, that sounds fantastic, Ramesh, and I'd love to help any way I can. And then literally 4.5 months later, I get invited to show up at Lafayette, Louisiana. Ramesh, working with the state of Louisiana, working with the University of Louisiana at Lafayette, and with the Office of National Coordinator, convened 300 people, doctors, patient advocates, health experts, and hackers and entrepreneurs from all across the country, including as far away as Germany, to come to Lafayette, Louisiana, to spend 36 hours forming pickup teams and leveraging open health data to build solutions that can help contribute to the fight against childhood obesity. 6 companies got spawned from this CodeFest, including a company that has as its newest member a kid from Germany who had registered for the Cajun CodeFest. The kid from Germany actually registered for the CodeFest. Ramesh got very worried. He actually called the guy and said, you realize you do have to come to Lafayette, Louisiana to compete in the CodeFest. He said, absolutely, but my dream is to come to America, to compete in the CodeFest, to invent something, join a company, and build a company in Lafayette. And sure enough, one of the 6 companies has as one of its newest members a kid from Germany who's going to help build an amazing company that helps contribute to the fight against childhood obesity. And it's just a living embodiment of the American dream. So I just love that. I just love that. And actually, equally interestingly, previous CodeFests and hackathons are spawning innovations that are sticking. So one of the stories I like to tell a lot about is this team of folks from Pittsburgh who call themselves Team Maya. They had no background in healthcare at all, but they came last year to a Academy of Health and Georgetown University-sponsored health data hackathon. They hadn't gotten the memo about what's impossible, and so they decided to solve the problem of food deserts, right? The problem of vast swaths of America where if you look at our data, you can't get access to healthy food in those areas. They decided to solve that problem, this very intractable problem, in 8 hours. And they came up with a solution called Food Oasis, which is this brilliant mashup of text messaging and farmers markets. I think it was kind of a flash farmers market offering. They now actually partner with a major American company. They have funded actually going to, with the help of this company, 3 American cities in beta test. They want to turn to an actual operating concern. And it's just very, very exciting, incredibly exciting. There are more seed accelerators. So one of the most promising developments, I think, of late has been the emergence of seed accelerators that are really focused on health, wellness, and healthcare. Folks like Startup Health, Rock Health, HealthBox. This is a picture of the wonderful first class at Blueprint Health. All of them actually now welcome their first classes. They're actually now also soliciting their second classes. But these are entrepreneurs who, again, haven't gotten the memo about what's impossible, are dreaming up incredible new services and companies, and are hungry for health data that can help feed their ingenuity. And just as a punchline, as a final punchline on what's new, and in terms of more and more innovation happening that actually uses the data, I think this Palooza is a phenomenal exhibit, a phenomenal cross-section of what's going on. So today and tomorrow, we'll be showcasing and celebrating the work of 100 companies and nonprofits that were selected from a field of 240 plus organizations by independent panels of patients, doctors, nurses, community leaders that exemplify the use of data, open data, health data, to improve American life and create jobs. One of the things that's most stunning to me about this group of companies, about the 240 plus actually that applied, is I think I know a lot about this space. I've gone to a lot of hackathons, I've done a lot of meetups, I've participated in a bunch of different challenges, and I looked at the portfolio of 240 plus companies that applied to be part of the American Idol process. I hadn't heard of most of them. I was like flipping through the book saying, who are you? Where did you come from? And I was so excited that I had no idea who these folks were. I looked at the founding dates of the companies, and they were 2012, 2012, 2011, 2011, 2011, 2011. This is fantastic. This is fantastic, because to me, it's actually the latest proof that this ecosystem of innovation based on health data is well and truly out of control. Out of control. Like all great innovation ecosystems are, right? They're beautifully chaotic, decentralized, self-propelled. And to me, it's also the latest evidence that Health Data Initiative is really, truly not a government initiative. It really never was. It's an American initiative. It's owned by change agents from all walks of life, united by the belief that you can harness the power of health data to make a difference in the world, to save lives, improve lives, grow the economy, and create jobs. And so I just love how out of control this all is at this point. It's just spectacular. So I now have the very difficult task of helping you navigate the field of awesomeness that is the Datapalooza. So I was actually pouring through the agenda this week and trying to figure out how, as a fanboy, I was going to navigate the Palooza and get the most out of it. So these are the tips I gave myself, which I'll share with you as well. One is, don't miss the plenaries. Now, I have a confession to make, which is that most conferences I go to, I skip the plenaries, right? You should not skip the plenaries at this Palooza. There are spectacular demos of innovations that help consumers, doctors, nurses, community leaders. There are also amazing major announcements that will be made. And at what other conference are you going to be able to see on stage Secretary Kathleen Sebelius, Senator Bill Frist, Tom Getz from Wired Magazine, and John Bon Jovi, right? You just don't want to miss that. You don't want to miss that combo. You do not want to miss that combo. You should also make time to check out the Apps Expo, opening at 1 p.m. today. So this is where basically I think virtually all 100 companies will actually have a table or presence of some kind. You can actually hands-on check out their innovations, talk to them one-on-one. It's just, there's no substitute for just walking the earth of the expo and just experiencing the kung fu of the innovators personally, one-on-one. We're going to actually be opening the Apps Expo at 1 p.m. today with an announcement of the top prize winners, the top points getters, the top favorites of the judges in each category: consumer, innovations for healthcare providers and for communities. So you don't want to miss that. There will also be a series of afternoon demo sessions as well that you'll want to check out. If you're a developer, you may want to check out the session today about the new healthdata.gov, which has a lot of developer-friendly features in it that folks like George Thomas have worked very hard to build in there. There's also a data lab that will take you through just a flyby of a cross-section of amazingly awesome data sets that are available to you to build with. There's a health GIS session. Tomorrow there are sessions on APIs and privacy security, a critically important topic to weave into your work. If you're an investor or biz dev person, you should check out, there's a session that McKinsey is doing this afternoon where they've actually analyzed the opportunity to create value with big open liquid health data. Fantastic initial analysis that they'll be presenting in their value pathway session. And then a business roundtable with successful CEOs who've leveraged health data into great value creation. And then a Atul Gawande session on accountable care organization, value creation, leveraging data. Tomorrow is, I think, a can't miss either. If you're interested in consumer innovation, check out the consumer engagement track that's actually happening this afternoon. Also, crowdsourcing, hotspotting, and the food and health tech session. Very exciting, new frontier for Health Data Initiative, food and health tech, that's happening tomorrow. If you're interested in innovation for doctors, nurses, hospital systems, you cannot miss, do not miss, Dr. Gawande's Accountable Care Organization session tomorrow. Going to be very, very exciting. How are accountable care organizations, how can ACOs and other organizations that are value-based purchasing-oriented organizations literally leverage health data and data of all kinds, claims data, to take better care of folks and create benefit. If you're interested in how data can help improve health communities, there's a big session on that tomorrow. Do not miss that. And if you're interested in all of the above, Josh Rosenthal and an amazing all-star crew are actually holding a session this afternoon about how to turn data into information with actual games. It's like a graduate level course that he'll be teaching, which we're very privileged to have him here to do. If you're also interested in all the above, just also resign yourself to the fact, like I resign myself to the fact that you're just going to miss stuff. You know, I mean, you're kind of in the pickle, right? I mean, unless you can be in 8 places at once, you know, you'll miss stuff, but that's okay. You know, try to catch up with other folks. The folks who put this event together packed it with so much protein, it's just impossible to digest it all, but we'll all do our very best, I'm sure. And then last but not least, there are just a lot of people to thank who have actually put this event together with an unbelievable, superhuman effort. So to our founding sponsors, and in particular the Robert Wood Johnson Foundation, Institute of Medicine, California Healthcare Foundation, thank you from the bottom of our hearts. Special thanks to Vicki Shepard of Healthways and Bill Davenhall of Esri, who led an impressive grassroots effort to get corporate sponsors. The many sponsors who made this event possible will be featured in many ways the next 2 days, so please thank them for helping to throw this palooza. To Dick Foster, Bob Kocher, and the planning committee, who are responsible for putting together this incredible protein-packed agenda, thank you so much for your phenomenal commitment to the cause. To Matt Miller and Tom Getz, I think Bert Parks is actually the Matt Miller of the Miss America pageant, quite honestly. And I just can't imagine 2 better MCs than the 2 of them for the Palooza. I also want to acknowledge a group that traveled all the way from London to join us in the Palooza. Minister of Health Andrew Lansley, Sir Bruce Keogh, and Mark Davies, who brought their team of data experts. They skipped the Queen's Jubilee to actually be here with us to learn more about open data, entrepreneurship, leveraging that data, and to contribute to the dialogue. So a big thank you to them for coming to hang out with your cousins across the pond. A big tip of the hat to Matthew Holt, Indu Subaya, and J.L. Neptune, Jean-Luc of Health 2.0 for managing the logistics of that incredible American Idol competition that produced the results you'll see today. To the West Wireless Foundation and their support for training, education, and innovation using health data. We appreciate your commitment to this incredibly exciting future. To my soul sister, Judy Salerno, Executive Director of the Institute of Medicine, and the team of Danielle Turnipseed, Brad Eckert, and Lauren Schern, along with the Godfather Harvey Feinberg, who continue to raise the bar for these events, as well as sponsor things like the Go Viral for Health Challenge you hear more about later today. The Institute of Medicine is an unbelievable organization, and they've done an unbelievable thing helping to bring all of this to life. To Greg Downing, Aman Bandari, and Arnab Chatterjee for being such brave warriors for truth, justice, and the American way. Greg, I know you're watching with your headset on. I love you, brother. You demand. A salute to all of the government leaders, the other leaders today who have been Simone Bolivars of health data liberation. All of the work that you're seeing rests fundamentally upon their leadership in liberating the data and making it machine readable, making it available, educating folks about it so they can turn it into all kinds of products and services. And finally, last but not least, very importantly, thank you to all of the innovators, the entrepreneurs, the change agents from all walks of life, so many of whom are here, who have played a huge role in bringing innovations like the ones you'll be able to see at the Palooza to life. You, to us, represent a big part of what makes America, America. You embody the spirit of a country that hasn't gotten the memo about what's impossible, that believes to the core of its being that there's no problem we have that we can't invent our way out of, and that can take something as seemingly mundane as health data and turn it into magic. Magic that improves lives, saves lives, grows the economy, and creates jobs. Welcome to the magic show called the Health Datapalooza. Thank you so much to all of you for everything you've already done for the cause. Thank you even more for what you will do going forward in this golden era of entrepreneurship and innovation in healthcare, data, and IT. Thank you for everything. May the force continue to be with you. God bless you. God bless America. And have a fantastic, fantastic 2012 Health Datapalooza. Rock on.